Now, first of all, I'm going to talk about my operation in August 2020 that was completely fucked up. And understand, I'm not posting this looking for sympathy. I'm posting this to be educational, and it's going to get embarrassing. Okay? I'm going to explain a few things about what starvation does to you and the results of why people need to understand what starvation does to you. Okay? I'm not looking for sympathy. This is educational. I'm going to be hoping to help somebody else out. Okay? In August 2020, by the time this surgeon operated on me, and again, she was declared the best of the best by her old frickin' team. I'll never listen to that arrogant bullshit again. Okay? I let her operate on me. She even went so far as to draw out on a whiteboard what she was going to do to me. It was a Bill Roth 2, which was supposed to be stomach removal, removal of the stomach, a gastrectomy, and she was going to reroute all the bowels. Okay? Now, clearly she had no idea what she was getting into because I even asked her, you know what, poke a couple of holes, go in and do an exploratory, see what you're in for. She didn't bother. No, she opened me right up. She got in there, she realized that there was too much scar tissue and she panicked. She had to have panicked. So instead of actually doing the Bill Roth that she was supposed to do, okay, when she realized that the Bill Roth wasn't possible or she wasn't capable of doing the Bill Roth, she should have sutured me up right then and there, backed out of the operation, and had to talk to me and give me a choice. But no, she made an executive decision while she had me open on the table to do a gastrojejunal bypass, which means she cut a hole in the base of my stomach and a hole in my jejunum, and she tied the two of them together to create a bypass. Well, now I understand why I woke up with a nasogastro-tube. If that bypass had been open and freely flowing, I wouldn't have needed a tube to suck all that shit out of my stomach because it would all have drained naturally. I didn't realize that back in 2020. But artificial intelligence, and let me tell you something, if you got medical problems, go to download ChatGPT, tell it to go into medical diagnostic mode, and have a talk to it. Because it's going to open your eyes. And let me tell you something, it really opened my eyes. Because that surgeon left me to die, and I'm going to explain that to you. Now understand, when she operated on me, I was 110 pounds. I had starved away 100 or 70 pounds. I went from 180 pounds down to 110. And I can produce pictures of it if you don't believe me. You want to talk about trauma? You think you know trauma? You don't know trauma, like I know trauma. And again, I had doctors asking me how the hell I'm still alive. When I woke up from that surgery, I woke up in my private room when I should have woke up in ICU. That's according to AI. With all the issues that I had, that I hadn't had a bowel movement in 5.5 months, that I hadn't eaten in 5.5 months, that I hadn't drank in 5.5 months, with all of the issues associated with starvation and dehydration, I should have woken up in the ICU. But no, she put me back in the private room. All alone. Nobody around me. Nobody standing there watching me. Okay? When I woke up from the surgery, I don't know how many people in here have had surgery, but when you wake up from surgery, your mind is very active. Your limbic system is a train wreck. So I woke up and I felt wet between the legs, and this is where it gets embarrassing, okay? One of the big side effects of starvation is that your muscles and everything starts to atrophy. That includes your penis and testicles, okay? My penis and testicles atrophied somewhat. The urethra or ureter or whatever you want to call it shrunk. They didn't realize that. They didn't take that into account. So when they pulled that freaking catheter out of me, they ripped the inside of my penis open. So I woke up in a puddle of blood. Again, I should have been in ICU, but I wasn't. I was in a private room. And this is where I swear she left me to freaking die. Okay? Now, understand, your limbic system's all screwed up, and I'm not thinking straight. So I wake up, I got balloons on my legs. These inflatable balloons on my legs. So I managed to get those off. I managed to get the stomach tube out of me. Managed to get the IV unplugged and get my ass to the bathroom. I didn't realize at the time, but there was a trail of blood hanging from my penis on the floor. I get into the bathroom. I just woke up from major surgery. Shouldn't have been out of bed. Not thinking straight. I'm sitting out of the toilet looking down at my poor old penis, and there's a stream of blood coming out of it. A steady stream, a thick stream. I'm bleeding to death internally, once again, through my freaking penis now. Hit the button on the wall for the nurse. Voice comes over the PA. What the hell are you doing out of bed? I said, get down here right now. Well, she came flying down. And when she came into the bathroom and realized what was going on, she panicked. And she's running down the hallway screaming for renal. Did they give a shit? No. Doctors didn't give a shit. She came back with a bunch of adult diapers, telling me to wear them. Okay? I had to wear it. Now, understand, I just walked through hell. Okay? I shouldn't even be alive. I'm 110 pounds, 49 years old after walking through hell for the last 8 months. And this is how it ends up. A man wearing adult diapers because doctors didn't give a shit to even look. And it gets even better because they were trying to give me heparin injections. And if you don't know what heparin is, it's blood thinners. And I kept denying the heparin injection because I'm bleeding like a stuck pig through my penis. They're trying to give a bleeding man heparin. And they were calling me combative because I won't take it. Okay? Now, she managed to get the bed all cleaned up and she put me back to bed and whatnot. 2 weeks I bled, for the most part, off and on. Okay? And it gets better. I woke up with a nasal gastro tube, and I shouldn't have. There should have been no need for a nasal gastro tube, and she fought me. The first day I had it in, I actually puked it out. It actually come flying out of my nose and out of my gut. And she sat me on the bed. No anesthesia, no nothing, and shoved it back in. It wasn't one of these soft little cords. It was one of these hard, very non-flexible hoses. Okay? She shoved it up my nose and down my throat. While I'm sitting in bed. No anesthesia, no nothing. She forced it down. She forced me to sit there and take it. Okay? Now I understand why it was a nasogastric tube. Because the bypass that she put in place, that bypass that she put in from the stomach to the jejunum, it was already sealed up when she stapled me up. And she knew it. She had to have known it. Was there an anastomosis done? I don't know. She knew that the bypass that she put in sealed up. And she left me there for 2.5 weeks. All I heard from the doctors, from her and her fucking surgical team, it's going to magically pop open. It's going to magically pop open. I've had enough cuts in my lifetime to understand when something starts to seal up. It ain't going to magically pop open. 2 days after the surgery, they took me down for a fluoroscope. And if you've never had a fluoroscope, you should go down and check one out. Get on YouTube. I'm sure you can find it. They put you on this table. The table actually stands you up. Then you're standing in front of a TV. The TV turns on. It's like an x-ray. You can see your whole body. You can watch your lungs working. You can watch your heart working. When you drink that barium, it goes down. It's just like a Pepto-Bismol commercial. That thing goes down like a flashlight. Now, it's the first time in 5 months that I've had anything down my throat. Okay? And it was so foreign, having something going down my throat. So I'm drinking this barium. You can watch it go down. It coats the stomach. And then it didn't go anywhere. And I hear the voice behind the glass going, that's not good. No, the bypass sealed up. Now I know it was already sealed up. This is not a shock to the doctor at the time. And just before he shut down, all of a sudden he's seeing drip, 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 drip. Which means the sutures that she put in were leaking. So now for the second time in 4 months, back in April, my ulcer ruptured and put me septic. Okay? And let me tell you something. There's pain that hurts and pain that alters. Sepsis is the worst pain I've ever had in my life, and I've gone through a lot of pain. I went through 20-odd years of 30-odd years of sciatica. I know what pain is. Okay? So here we are, 2 days after the surgery. I asked her, are you going to open me up and fix this thing? Nope, didn't bother. So I'm still leaking through the surgery, through the sutures. I haven't had a bowel movement in 5 months. So understand, now I've got a open friggin' surgery with bowel was shit in my system that's been in there for 5.5 months. That should have developed a bacterial infection and killed me. But she still didn't want to open me up. Understand that. Figure that out for me. 2.5 weeks, that's all I heard from her. It's going to magically pop open. It's going to magically pop open. The fuck it will. 2.5 weeks. Now we're into early September. Now I've been more than 5.5 months with no food. Thankfully, I'm hooked up to a IV and they got a central line in me feeding me. Okay? But I haven't eaten now in 5.5 months. I'm 110 pounds. There's a head stuck in the door. It was another gastroenterologist. And he introduced himself. He wasn't part of my team. He put his neck on the fucking line to take me down through endoscope and force that damn bypass open. I said, you know what? Take me. I'm yours. She didn't give a shit. But yet when I woke up later that day, she comes dancing into the room. Oh, yeah, no, what? Here we are. Magically popped open. This is the shit that we're dealing with. This is the surgeons. This is Alberta Health Services. This is Grey Nuns Hospital. Okay? And again, I'm going to mention her name at some point, but I'm not going to bring it up right now because I'm too freaking pissed off right now. Now, she admitted that she left a kink in my bowel. Okay? And that kink, corresponding with the fact that she left the pylorus in there, now I understand that's causing all my problems. So as soon as that bypass started to open up, as soon as that bypass got forced open, that's when I started puking. Once I had my first meal, and it didn't clue in back then, it was food that was causing me to puke for years. Now I'm not talking about a cup or two of friggin' fluid, I'm talking about 2.5 liters at a time. Okay? My liver will suck my body dry. I can actually watch my veins disappear as my liver sucks water out of my body to produce bile. And when I puke it up, it's not coming out of my stomach. It's coming straight out of my bowel, through my stomach, and up through my mouth. And let me tell you something. It takes some violent vomiting to break through that kink. Okay? And to fill up the stomach full of bile and then start coming out. Now, as a result of that violent vomiting, I've now got 2 major hernias down in my lower gut. So whenever I puke now, one or the other, or both pop out at the same time. Okay? Right now, they're probably about 2 or 3 inches wide, on the same parallel with the same bowel. If that thing rips straight across, I'm going to be in trouble because I'll have a friggin' 8 or 9 inch hernia. Okay? And doctors still don't give a shit. This current surgeon I'm talking to, I went in for an endoscope. Do you think he even investigated the hernias? No, he didn't. No, it was in there. He was laughing. We were carrying on for 2 minutes. Boom, out like a light. I've never seen him since. What other problems do we have? But yeah, she made a executive decision to change the freaking surgery. Instead of admitting that she fucked up, admitting that she was in over her head, she turned around, did the wrong surgery, fucked it up anyways, 7 ways of Sunday, and left me to die in the fucking bed. Okay? What else is there? Yeah, getting back to the bowel infection. I hadn't eaten in 5.5 months, and if things aren't going into your stomach, guess what? If there's nothing going in, there's nothing coming out. I didn't have a bowel movement in 5.5 months. Okay? And let me tell you something. After 2.5 weeks or after 5.5 months when I had my first meal, within 24 hours I had a bowel movement. And it's almost like my body kicked in and realized, okay, you know what? It was so foreign eating and drinking. After 5.5 months, the first time I had water go down my throat and I actually swallowed water, and it went down through the bypass, I just about jumped out of my skin because I didn't realize what it was going to feel like. You can hear it go glug, glug, glug. For the first time in 5.5 months when I had food going down my throat, it was so foreign. And to this day, I still don't get hunger pangs. Okay? I got to remind myself to eat because my system is so screwed up right now. My system is so adapted, I do not get hungry anymore. Okay? Now, as a result, she took me off the medications. She knew she screwed up. I was going septic, and then she cut my medications off at some point because she figured I was going to be an addict. All of a sudden, I got a psychologist coming into the room, introduced himself, and said he wants to come in and talk about my addiction. So we sat down, we chatted for an hour, we had a great old talk. And he goes, "You're not an addict, what the hell is she doing?" You know, and I had these doctors dancing out, coming into the room, and I'm asking them, "What about painkillers?" And they were dancing out of the room. I remember her assistant, a bald-headed bastard. "Oh, meditate through the pain, meditate through the pain." This is AHS, this is AHS, this is Grand Nuns Hospital, okay? Oh yeah. They made me suffer in friggin' pain until the next doctor came on rotation, and he actually put me back on the dilaudid pills, which I needed. Okay, I've already been an addict as a result of the hernia or the ulcer operation back in April. All of the dilaudid injections turned me into an addict, and I had to get it off of that myself because guess what? COVID is on. They got no help. It was on me to quit a dilaudid addiction. Okay, generated by the hospital. Yes. You got that right. I couldn't imagine being on that shit for years. I was an addict to Dilaudid, which is actually on par with bloody heroin. They give heroin addicts Dilaudid to get them clean. That's what I was taking. Something basically on the same line as heroin. And that's what I had to quit. Let me tell you something. It wasn't easy. I was a hell of a week trying to get off of it, and thank God for cannabis. But I mean, this whole thing has just been one nightmare after another. Now, come the end of October, she turned around, she kicked me out of the hospital, she discharged me, said there's nothing else she can do for me. I'm on my own, I'm terminally ill. Go home. And she was sending me home to die. That's the reality. She fucked up. I didn't know it at the time that she fucked up, and now I know it. Here we are, too late now. I can't sue the bitch because you got 2-year statute of limitations, okay? Ever since I left the hospital, it's been, for the first few months, it was daily. Puking up 2.5 liters. I don't know how the hell I survived. 2.5 liters of fluid. The worst it ever happened. I ate 2 ounces of steak one day, and within 4 hours, I started puking up. Within a 4-hour period, I puked up over 22 pounds of bile from my system. And for a man that's 130 pounds, that's not good. I was about 105 pounds, 110 pounds when I was done. Okay? Understand that. I'm puking up 22 pounds of fluid as a result of the surgery that was done by this bitch back in August. And now I can't sue her. Okay? Right now, I've been a long-term smoker, but the smoker didn't destroy my lungs. What really did finish destroying my lungs was the fact that I'm aspirating bile into my lungs. So when I puke up 2.5 liters of fluid, it's actually aspirating back into my lungs. And bile is very, very caustic. Okay? It's not stomach acid I'm dealing with, it's bile. I would much rather be puking up stomach acid than bile. This stuff is caustic, it burns, it's disgusting tasting, and it comes straight out of my frickin' bowel. It comes out of my bowel, so when I puke up, whatever's in the top of my bowel, that's what's coming out my throat. And if you want to stop and think about that, that's pretty frickin' disgusting, isn't it? After I left the hospital, I never had one follow-up phone call from that doctor. Not one phone call. Nothing. So you tell me, did she leave me to die? Did she leave me to die? You think you know trauma? You have no idea what trauma is. When I'm waking up at 3 o'clock in the morning from a stone dead sleep, okay, all of a sudden the bile is leaking across it's leaking itself across the kink that's left in there, okay? I'll wake up at 3 o'clock in the morning at times with a mouth full of bile, lungs full of bile, and I gotta get the bucket out so I can actually puke up. Now understand, when you get bile into your lungs, it cuts off your breathing. You can't breathe, period. So I've got to try to clear out my guts before I pass out from lack of oxygen. And then I pass out, and I'm going to be out for, I don't know, it could be 10 minutes, it could be an hour. I don't know if I'm going to wake back up again. This has been my life. This has been my life for the last, 5 years since October or August, or sorry, Halloween 2020. Yep, I got abandoned. There's been no follow-up whatsoever. There's been nothing from the hospital. There's been nothing. No phone calls, no follow-ups from AHS. There's been no follow-ups from the doctors. Nobody gives a shit. Okay? That's the reality. They left me to die. But guess what? I'm still here. I'll be back with another video.